today?
I'm good, how are you?
Good, thank you. My name is Elizabeth. I'll be your nurse today.
Oh,
taking care of you.
my name is Elizabeth.
Really?
Yes.
Okay. What is your full name?
Elizabeth Curry.
Okay, and your birthday, please?
4892.
Okay, great, thank you. We're going to start off with a general assessment and a cardiac assessment today. I'm going to go wash my hands. I'll be right back.
Okay.
Is there anything you need in the meantime?
A lemonade, but I'll be fine.
Okay, I'll be right back for you. Thank you, Miss Curry. Thank you for your patience. Could you sit up in the bed?
Sure.
Would that be okay? Do you need a little help?
I'm good, I think.
Okay, use that blanket for me. I'm going to begin with just a general assessment of your skin color and your breathing and everything
Okay.
like that. If you could just stare at that clock on the wall
Sure.
for me. Just relax, breathe normally. Skin color is normal and consistent with the lips and skin color of the rest of the body, and respiration rate is normal. Okay, Ms. Curry. We're going to move on to the cardiac assessment. I'm first going to inspect your anterior wall for contours, retractions, lifts, heaves, anything abnormal.
Okay.
So if you could just relax for me. Okay, great, looks good. Now I'm going to move on and auscultate the valve sounds.
Okay.
We're going to start on the top right here at the second intercostal space, which is your aortic valve. Just relax for me. Sounds good. I'm going to move to your left. Also at the second intercostal space, the pulmonic valve. Okay, and at this point I'm going to move towards the midline of your body and auscultate for S2. Okay, and this is at the base of your heart. We're going to go back to the pulmonic valve, move down to the third intercostal space, which is the Erb's point. Okay, and then down to the fourth, which is the tricuspid. And we're going to go down around here to the fifth. This is the mitral, also known as the, this is where the apical pulse is as well. Do you mind if I just look this up?
That's fine.
Okay. Okay, this is at the apex of your heart, and I'm also going to listen for S1 sounds towards the midline of your body. Okay, sounds good, great. Okay, and the last thing we're going to do, I'm going to palpate your apical pulse, which is at the fifth intercostal space at the mid-clavicular line. I'm going to start here. Aortic. Okay. Okay, let's carry everything sounds and feels normal.
Okay.
Okay, great. Thank you so much.
Thank you.
Okay, Ms. Curry, we're going to continue with the assessment of your peripheral vascular system. Are you comfortable?
I am.
I want to raise your bed up a little bit, so don't be startled to my working light. Okay. We're going to begin with the assessment of your carotid pulse. For your pulses, I'm checking for rate, rhythm, and depth. I'll keep that. My hands might be a little cold. Okay. Okay, right now I'm locating your sternocleidomastoid, and your carotid pulse lies perpendicular to that. So I'm going to move over a little. Okay, good. And so. Great. Okay, we'll now inspect your jugular veins. We're checking for distension and obvious pulsations. Okay, no distension and no pulsation. Okay, good. Now I will check your blood pressure as well. Do you have a preference?
Oh no, whatever arm you feel.
Okay. Your blood pressure is 115/72, which is good. Nice and normal. Now I'm going to continue on with the assessment of your upper extremities. I'm checking for skin turgor, temperature, and color. Okay. Begin with skin turgor. You're going to feel a little pinch. All I'm checking for is the hydration of your skin to see if you're dehydrated. And it goes back just like it's supposed to. Okay. Skin color is good and even on both sides. Skin is warm, temperature is good. Now I'll check your nails for capillary refill. Nails are at a 160-degree angle, which is normal. And capillary refill is less than 2 seconds. Great. I'm now going to palpate your brachial and radial pulse, the upper extremities. Start with your brachial at the antecubital fossa. Your radial on the thumb side of each lower arm. Okay, Ms. Curry, I'm now going to palpate your femoral pulse. I'm going to start at your anterior superior iliac crest here and move towards your symphysis pubis. Okay? Are you still comfortable?
Mm-hmm.
Okay. Okay, great. I'll now palpate the popliteal pulse. Now, generally, our patients are laying in a prone position. We're going to keep you supine for your comfort. You could elevate your knees for me here to a 30-degree angle. And check behind each knee for your pulse. Okay, great. Lower your legs for me. Thank you. Now, do you mind if I take your shoes off and socks off? Okay. I'll be checking your posterior tibial pulse and your dorsalis pedis, which is in between your first and second toe on each foot. Start with your posterior tibial. It's on the inside of your ankle here. Okay. Your dorsalis pedis in between the first and second toe. Okay, great. Now just as with your upper extremities, with your lower extremities, I'm going to check for skin turgor, temperature, color, and hair distribution as well. So we'll start with just raise your hands leg up a little. Okay. Okay. Start with skin turgor. You're going to feel a little pinch. Checking for the hydration of your skin. Okay. Skin color is good, and even with the lips and the rest of the body. Skin is warm, temperature is good, and hair distribution is good on each side. And we'll check your capillary refill of your toes as well. Okay, capillary refill is less than 2 seconds. It's normal. Very good. And then the last thing I'm going to assess is I'm going to check for any tenderness in your lower extremities. So let me know if you feel any pain, okay? Any pain? But you can feel that I am assessing.
Yes.
Okay, great. Okay, thank you, Ms. Curry.
Thank you.
Okay, Ms. Curry, you doing okay?
Yes, how are you?
Good, doing well, thank you. We're going to finish up your assessment today with the respiratory assessment. Are you comfortable?
Yes.
Okay, if I could just have you sit upright, just relax, breathe normally. You can stare at the clock for me. Okay, and now I'm assessing her breathing patterns, her respiration, and her general appearance. Breathing patterns are normal, quiet, and effortless. Okay. Respiration rate was at 13, so that's normal.
Okay.
I'm just going to assess your skin and your nails. Okay. Skin is overall even color, your lips and your body. Going to assess your nails to make sure you are receiving enough oxygen. Okay. Good to go. Okay, Ms. Curry, now I'm going to auscultate your posterior thorax for breath sounds. I'm going to go to the back of you. Start with the assessment. If you just sit up straight for me. Okay, everything looks symmetrical. Your scapulars and shoulders are symmetrical along with your spine, which is okay. Your spine is straight. Okay, I'm now going to auscultate for breath sounds. And when I place the stethoscope on your back, if you could just breathe in, okay, and breathe out, okay? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. Okay, muscle development is good, posterior as well. Okay, now I'm going to move to the anterior thorax. Your shoulders are symmetrical, posture is good, and okay, good muscle development. And I'm also going to take the anterior thorax as well for breath sounds. One, 2, 3, 4, 5, 6, 7, 8. So everything sounds good, so that concludes our assessment.
Okay,
Have a good day.
thank you.
Thank you.